Okay, so I'm going to move fast because that was great conversation. My name is Lisa Patterson. I am one of the other clinical therapists on the palliative care team at Cook. I would love to see a show of hands if anybody knows what palliative care is. Some? Okay, that's helpful to me. Has anybody ever experienced or worked with palliative care before? Okay, awesome, awesome. All right. You're going to stand here and do this for me?
I will.
Okay, good friends. So I'm hopeful today that the objectives that you will walk out with is that you will develop a better understanding of what palliative care is, that we can talk about what the benefits, the potential benefits of working with a palliative care team is, and that we can identify who can benefit from a potential referral. So this really means a lot to me, this statement, and it really is very descriptive about what palliative care is. We are there for the journey. Palliative care is not synonymous with hospice or end of life. And I think that often that is what people think of, right? When you hear palliative care, they're thinking, it's hospice, it's end of life. What are they not telling me? Why do they want me to see somebody with palliative care? So as we go through this, in the time that we have, hopefully you will have a better understanding. But the truth is, this is one of those truths. We might not be able to change the outcome, but we absolutely want to be there for you as part of the journey. So the palliative care team, as Christy had said earlier, is made up of nurses, doctors, social workers, chaplains, child life, and then our administrative support. We need every person on this team to be part of this village to help our families. It does not work if any one of these pieces are missing. Christy and I were the social workers for our team, as she said, for years. And when we realized the gap that was created, that the families and the parents, they needed support too. They needed emotional support because of exactly what you guys are saying. It is a chronic grief and loss process that you're going through. Every time there is a diagnosis, when there's a decline, when there's a setback, when you're back in the hospital and you've learned something new, when a new medication is added, when it's not working and you're calling again and you can't get someone to answer and you need to know what to do, the frustration and the exhaustion of that takes a toll on you as parents and caregivers, and all of these people need to be present to help you work through that. So I also love this slide because this represents what I think people think of when you hear palliative care. We get referred to at the hospital as the death squad. We get referred to as the Grim Reaper. When people hear palliative care, even in our own institution, our own physicians, our own nurses, our own staff, I will get a call and they will say, I didn't know that child was going to die. Why is palliative care involved? So again, it's an education process, even for the people in our own institution, to explain we are part of the journey. That is what we are here for. So at diagnosis, we want to be involved. We want to start working with families from that time and for however long we can. That sometimes is a short period of time, and it can be 21 years. I want to make a distinction between palliative care and hospice so that everybody walks away with a good understanding of that. Hospice care is aimed at patients who have been diagnosed with a terminal illness. Hospice is normally at end of life. When the physician thinks, I'm not a doctor, when the physician thinks that someone might have within 6 months to live, and if they have goals of care that align with hospice, we will make a hospice referral. Palliative care is for anyone who has been diagnosed with a life-shortening or life-threatening illness. So you might have an illness that we know has a shortened life experience or expectancy, but you might live 21 years, 37 years, 40 years. We are there throughout that journey as you're making decisions and figuring it out. The palliative care team can get involved through a physician referral, so physician to physician. If your PCP feels like engaging with the palliative care team would be helpful, a physician to physician referral. A nurse can make a referral to our team, and family request. We have families who say, I was at a conference, I heard someone talk about palliative care, I think that would be appropriate for me, and you guys can call and we can do an assessment and see if it is an appropriate referral. For me, palliative care is about believing, hoping, and having faith. We are a multidisciplinary approach to the relief of suffering and distress for families living with serious illness. We provide specialized medical care for children living with complex, chronic, and serious medical conditions. We work with children of any age, from prenatal through young adult, and our focus is on improving the quality of life and support. We really work to support the entire family, which is why that whole team was important before. We recognize and realize this is not about just symptom management for your child, just running tests. We understand that there are siblings, there are parents, there are grandparents, and that the entire family is impacted when a child has a medical diagnosis that is life-shortening or life-threatening. One of the several things that we do, we provide pain and symptom management. So we work with, our physicians work with the pain team, and they themselves work to manage the symptoms. They work with the other physicians to manage symptoms, to find a plan that works. We try to be advocates for you when you're struggling, when no one will call you back, or when the medication that you're trying is not working. We want to work with you and the other physician and help. We partner with the child's other care providers, like I just said, to provide an extra layer of support. Families need not have a terminal diagnosis. Palliative care is not synonymous with end-of-life care, or is it the same as hospice? It does not mean giving up or loss of hope. So I want to make really clear, with palliative care, we are not giving up. You can be in palliative care and continue treatments, testing, trials, medications. We are trying to manage as best we can so that your child can live as well as possible for as long as possible. The last slide part on this is really important. I want everyone to walk away knowing that our families are actively living. They're coping with uncertainty, but our families are living. Dr. Todd Pearson is the one who said this all the time. I had the honor of working with him. He is very well known in palliative care circles. He has retired and we miss him a great deal, but he would always tell families, and it has always stuck with me, that our motto in palliative care is to hope for the best. We always are going to maintain that hope. Attend to the present. Where are we today? What can we do today? How can we help you today? What are the needs that you have today? What does your child need today? And focus on that. We want to celebrate success. Sometimes that is they swallowed. They passed their swallow study today. Sometimes it is we have not seen a seizure in 5 days. We are going to celebrate. That is success. And then we want to prepare for the rest. Palliative care is also about preparing for the rest through the grief therapy, through planning what your goals of care are. Those are important things in understanding you and making a plan. Some of the benefits of palliative care is that we have a teamed approach, like we've talked about, working with the child's other healthcare providers. We also work really hard on helping with access to community and home-based services and resources. So on our team, we have a social worker. When families come to us and there is a need, there is something that isn't working right, there's something that they're hearing that doesn't make sense to them about what resources are available, is that a resource I can apply for? There's a waiver program. Does that apply to me? How does that work? We want to help you find every resource and possible opportunity that we can find to help you navigate this journey. So in our consults, and I say consult in that we will meet with you, we will bring you in, your family, and we will meet together as a team. Normally it is the physician or a nurse practitioner and a social worker, sometimes the clinical therapist, sometimes a chaplain, sometimes a nurse. But we come as a team because we think it takes a village. And we will meet with you. We want to get to know you. We want to know what's important to you. We want to become familiar with what support you have around you. What advocacy groups are you involved in? What do you read? What do you see? What are you hearing? That's important to us in helping develop what your goals of care is. We want to be the specialist wants to hear everything and assist you with the big picture. Our appointments, our consults are different than others. I assume when you go sometimes to meet your doctor, you feel like you're in and out, 15 minutes, in and out, quick, go. We will sit for up to an hour and a half with our families to get to know them and to hear what they are experiencing. We want to hear everything about them.
And you know where we always start is tell me your story. We move them backwards.
Yes.
FYI.
The truth is that sometimes we do have to have a deeper conversation. Sometimes we are at a place of decision making. It's important to get a sense of a family's and a patient's goals, get a sense of their hopes, what are they most worried about, and have the family share about the symptom burden they are experiencing. And it is possible that we do get to a place where we do have to have some really difficult conversations, and that is part of the learning about goals of care. What is important to you? Is quality of life important to you? Is what interventions would you consider for your child? Questions? Did I do it in right time? Did I do good? Okay. Yes.
Is this covered by insurance?
It is.
Okay.
It is. So palliative care specialists are board certified in palliative care. It is the same as a neurologist. It is the same as a GI specialist. They are specialists just the same. So yes, it is covered under insurance.
And why is it that when your child is diagnosed, the doctor doesn't automatically tell you about
Palliative care. You're good.
Like, I wish I knew this from day one.
Yeah, and we do too. So I'm not sure. What I can say is I think that a lot of people don't understand it. I think a lot of physicians think that's end of life. That's if they need hospice. I think if your child is doing relatively well, and I say relative because that's relative, right? Well for you might not be well for the physician if you are distressed and there's symptom burden. So they just often don't realize or recognize the need for the palliative care team to become involved, to be an advocate, to listen to what you're going through, and to help you make a plan for your child.
Where do you live? I'm not sure that all health systems have palliative care teams.
I'm out of Boston, and we go to Mass General Hospital.
I know within Cook, we do have, I guess you would call them automatic triggers. There's certain diagnoses that are automatically referred to palliative care, but that's work to be done within each health.
I mean, I don't know any Dravet parent who wouldn't want this. It's just extra support to help you put everything in one place. So, yeah, I'm definitely going to go home and look into it, but I wish I knew about it from day one. So, thank you.
And I think that's where sometimes getting involved in some of the other support things like the ARCs and stuff in each of our states is kind of helpful too, to kind of get that on the...
I'm definitely going to do that.
Yeah.
When I get home, thank you. I put that in my notes.
You said you had that.
Yeah, just a quick question. We know some folks that have lost their spouse. Does this kind of care apply to that? It's not really medical, but they're certainly grieving.
Are you asking, like, would we do counseling for someone who's lost a spouse?
Yes.
So we are covered under the umbrella of Cook Children's. So Christy and our work is focused around for the parents of children that work with palliative care.
Okay, well, we're actually from the Tampa Bay area, but I just wondered in general, is palliative care administered to folks that have lost their spouse.
There's certainly no reason to say like no to that, but it is important to, there are differences in palliative programs.
Okay.
So it's not like a rule that that would have to be available to every palliative program. So maybe, depending on the program. They, like we often say, if you know one palliative care program, you know one palliative care program.
Yes, and there are people in the community that specialize in grief counseling. There are also adult palliative care programs. So Christy and I speak, really we're talking about pediatric palliative care programs. But there are, like Harris Hospital here in Fort Worth, they have an adult palliative care program. So some hospitals have it and some don't.
Hi, my name's Joe, and my comment probably relates more to the earlier presentation, but the best thing I've read that's helped me the most in getting used to the situation is something that my sister sent me as soon as I told her about my daughter. And it is a short article or essay called Welcome to Holland that I thought just was really apt. The other thing is, what I've found personally it helps the most is every time I'm not a normal guy who asks for help, but every time I ask for help with my daughter, I've been overwhelmed with the response, and it's made our lives so much easier than it would be otherwise. And I've met great people who've offered to help, but I've also found people actually want to help you. They just need to know how.
People really do want to help you. They often don't know what to say, and they don't know what to do. They are struggling to find the words. So to your point, absolutely, if you want, we encourage our families, ask for help. Let's talk about what you need. Rely on the support when people are offering. Say yes. I tell my mamas, say yes. If someone says, can I bring you lunch? It's our natural response to, I'm okay, I'm fine, no, I got it, I'll go down and get something. Two things we want to accomplish. When you say yes, that would be great, you are also helping them because they want to help. They want to do whatever they can to support you, and you're receiving the help, and it's a good thing. It's a good thing. Let them bring you lunch. Let them bring you a coffee. If they say, can I mow your yard? You haven't been home. You've been in the hospital for 12 days. Can we go clean your house? What would we say? No, don't do that. Say yes. I want to encourage people to say yes.
Yeah, we tell people keep a list on your phone so that when somebody says, what can I do? Pick one. Pick anything on this list that I need done. That'd be great. And I love that poem too. In a different presentation we included. Yeah, it's fantastic.
Okay. So
Thank you guys.
Are we good? Thank you guys so much.